Dr. Sarah Moyer is the head of the Louisville Metro Public Health Department. She's an assistant professor of health management at UofL, and she's here to talk about the stuff going on public health-wise in the city of Louisville. Sarah, good to see you again.
Glad to be here. Thank you.
All right. Well, where do you want to start? When do you want to start? You want to start with West Nile? That's the most recent thing to hit your department. So let's talk about West Nile virus.
Yeah, so it's that time of year for West Nile. It's in all of our mosquitoes across the entire county, and so encouraging everyone, if they're out, especially between dusk and dawn, to make sure you're wearing long sleeves, lots of DEETs, and watch out for those mosquito bites because it's pretty much in all of our mosquitoes now.
And West Nile, there were, 5 cases so far in Louisville?
We've had 5 cases so far this year in Louisville. No deaths. That's the good news. 5 cases that have been reported. The good news about West Nile is most people don't get any symptoms, but there are some that end up in the hospital pretty sick, and those are our 5 cases we've had.
And they're pretty, when you talk about pretty sick, are they potentially critical cases or not quite that bad?
It's a it depends. So like Hep A, there's a large range of symptoms. Some people don't know they have it, and some people end up in the hospital with really bad headaches, nausea, vomiting, really what we call neuroinvasive, and that's what you don't want to end up. So especially if you've got a weakened immune system, please make sure you're protecting yourself against mosquito bites. You're making sure your yards don't have any standing water. So just a cap full of water is all a mosquito needs to reproduce. So just making sure all your gutters are cleaned out, all your pans and pots and kids' toys are all dumped. Get rid of all that standing water from all that great rain we've had.
And I think I heard you say that just about all our mosquitoes in Louisville are carrying West Nile virus. Is that true?
That's true. We've found evidence of it in almost every zip code in the city.
But folks are immune to it, and most folks don't, when they get that mosquito bite, they aren't impacted by it, correct?
Yes,
okay.
But there's a chance, and it's hard to know which one you'll be. So especially if you have a weakened immune system, be careful of mosquito bites.
So older adults, folks with cancer or those kinds of things where their immune systems are compromised, that's who we're talking about here, right?
That's what we're talking about, yeah. Or if you're new to the area too, especially, and especially if you're out from that when it starts to get dark outside until the morning. That's when the mosquito that likes West Nile is around.
But it's October. There's not supposed to be mosquitoes around.
It's 85 degrees outside. It's hot. It's not really October. Yeah, so until that cold front comes in, we still have to worry about West Nile.
Okay. And these West Nile cases that just cropped up, were those people bitten by the mosquitoes like 2 or 3 months ago and the symptoms just promulgated themselves now, or was it something that was fairly recent, like they got bit in September?
Yeah, it was probably more recent than that. It's just like any other virus gets transmitted. It shows up in a couple weeks.
And what can happen with West Nile virus? You talked about the neurological symptoms.
Headaches.
But
like I said, most people don't get anything, but then it's kind of like a flu-like symptom, headaches, just not feeling good.
Just feeling yucky. But it can kill you, right?
It can, yeah. 2016, we had 1 death.
Okay, in our area.
City,
Do you know how many there were across the United States?
I don't know that number off the top of my head, no.
Okay.
Yeah, but CDC is reporting West Nile in almost every single state across the country, so it's a problem.
So it doesn't matter if you're going to Florida or New York State, wherever, you're susceptible.
It's this time of year, usually late August through until we get that first cold. It's West Nile season.
Gotcha. All right. We're talking with Dr. Sarah Moyer again, who's the head of the Louisville Metro Public Health Department and an assistant professor at the University of Louisville. We're talking about some of the health problems and conditions going on in the Louisville area. All right, hepatitis A. We've talked a lot about it on this show. You've been talking a lot about it out in the community. Where are we on the hepatitis A outbreak in the city of Louisville?
So that has more good news. So our outbreak is starting to slow. We're at 613 cases, which is a lot, but we're getting less than 1 case in a day reported to us, down from our high in about April, which was 4. So the numbers of new cases are slowing down. We're still encouraging everyone who hasn't been vaccinated yet to get vaccinated, especially in our 2 high-risk categories of people who use drugs or friends and family members of people who use drugs, and then also homeless or people with insecure housing.
Any idea how many folks in Louisville have gotten vaccinations since this whole thing started last spring?
That's a great question. So we have record about 90,000 from all our partner organizations. So reports from the hospital systems and big pharmacies like Kroger and
Walgreens
have given us numbers. So about 90,000 people that we know of since January.
That's a bunch of folks. And I know I got one. I'm not in the high risk category, but I got one. But I haven't had the second shot. Do I need to have that second shot?
So you're protected for this outbreak with just that one shot. So you probably have protection for at least 10 years. If you want to have lifelong protection and not have to worry about it 20 years from now, then go ahead and get that second shot in 6 months after you had the first. And anytime 6 months or later after that first shot.
And with the hepatitis A outbreak, were there any deaths? Were there any?
We've had 5 deaths with hepatitis A.
Okay.
So out of that 613, the majority of those 613 have ended up in the hospital, and we've had 5 deaths. So.
And when you get hepatitis A, even if you don't die, can you have some lifelong problems because you had hepatitis A right now? I mean, does it impact you for the rest of your life?
So hepatitis A, your body kind of clears on its own. I know some people complain of fatigue and some symptoms that might last longer than just the infection, but your body clears the hep A infection from the liver.
Okay, so you can get rid of it.
You get rid of it, which is
most
different than hepatitis B and hepatitis C that you have to take medicines and treatment for to get rid of.
We're talking with Dr. Sarah Moyer, the head of the Louisville Metro Public Health Department and an assistant professor of health management at the University of Louisville. And this segment is sponsored by Passport Health Plan. All right, we talked about West Nile. We talked about hepatitis A. I saw a report, I think it was on the national news last week maybe, that they're having some Zika outbreaks in Africa. Any reason for us to fear that there might be those mosquitoes somehow will manage to get to the United States and cause a Zika outbreak in Louisville, Kentucky?
So not this year. So Zika is one of the diseases that our mosquito team tests for when they're checking out the mosquitoes. So we know we have West Nile, and that's the only disease we know of in our mosquitoes right now. Zika is a lot harder to get here. They like a mosquito type that likes warmer climate temperatures, but there is a potential that it could breed into a mosquito we do have here. So possible threat down the road, but don't worry about that one this year.
Knock on wood. Where's some wood? All right, yeah. I'm knocking right now.
But
it might be vinyl.
You do need to think about it if you're traveling to the countries that do have Zika, especially pregnant women and their partners, because that's the big issue with Zika is the birth defects that are associated with it. So caution if you're traveling, but you're fine if you're here for Zika.
All right, I know everybody right now is out there getting their flu shots, as you should. It's flu season. Well, it's getting to be flu season. Why are shots warranted in September and October? Because don't the flu shots only last a certain number of months if you get it now? Am I wrong or right about that?
So the flu shot changes every year, so people think it wears off, but it's good. It should be good for the entire flu season. And we're already starting to see a few flu cases already this year. So
in October?
Yep. So get that flu shot. And if you think about risk too, I mean, we talked about West Nile and hepatitis A that have had between 0 and 5 deaths with both of those. Flu, we had 49 people in Louisville that passed away from flu last year.
Wow.
So, it's probably the biggest impact, and the best thing you could do for your health is get your flu shot.
So 49 people died from a flu shot. How many of those had a flu shot? Do you know?
Majority of them did not.
Okay, as you would suspect.
Yep.
But some of them did.
I mean, it's the same thing we keep talking about, weakened immune system. And so that's why it's really important that, especially people that are around the elderly or kids under 5, that they make sure they have the flu shot, not just for themselves, but to protect their family members and friends.
All right, and after the flu season hits, you always hear in the media that it was, the vaccinations were only, 40% effective or whatever that percentage was, that it didn't stop all cases of the flu. Or all strains of the flu. And we never know going into like this year. We don't know if the vaccine this year will stop all the different strains of the flu. Right? Is that fair?
That's fair. So the flu vaccine is not quite as effective as the hepatitis A vaccine, but it's still super important because even if you might get the flu, it's not nearly as bad as if you didn't get the flu shot. So last year, a lot of the cases of people who had the flu, even though they had the shot, they were able to stay home, they were able to get better, versus the ones that didn't have the flu shot were the ones that ended up in the hospital and the ones that ended up dying. So get your flu shot no matter what. Even if you get the flu, it's not as bad as if you hadn't gotten the flu shot.
So that's the pitch to those people that say, well, I heard the flu shot's not as effective against all these strains of flu, so why bother and get it? Yeah. I don't want to get it. So that's your pitch, though, right?
That's my pitch, yeah. I mean, you might get it, but you'll be at home and you'll be back to work a lot faster than if you didn't get the flu shot.
Talking with Dr. Sarah Moyer, the director of the health department here in Louisville, Kentucky, and the assistant professor of health management at the University of Louisville. All right, well, let's talk about Healthy Louisville 2025. What is that?
So that's our community health improvement plan to improve the health of Louisville over the next 5 years. So we're really excited. We have a Healthy Louisville 2020 that we're wrapping up over the next couple of years, and we've just kicked off our planning for Healthy Louisville 2025. If you're interested in being a part of that, please go to healthylouisvillemetro.org.
Easy for you to say.
Right, exactly. And there's a great survey there. You can see all the results we had of our health impact, our health equity report, which has all the data of where different health outcomes affect different communities across our city. And then it also has the results of our community health survey. That's what I'm looking for. That community health survey looks at what the community cares about for health. So we combine what the data says with what people care about, and from that we get their themes of what we're going to work on for the next 5 years.
Well, that's what I was going to say. So we're looking at 2025, so you're talking 7 years from now. So is there anything that you can look in your crystal ball right now and say, you know what, this is a health issue headed towards Louisville, Kentucky in 7 years, and we need to prepare for it right now? Is there anything out there on the horizon that you see that we really aren't prepared for that we should be?
So infectious disease-wise, I think we're there. We've got a great mosquito control program, so something new pops up. There'll probably be a new Zika on the horizon. It will be great. The big things that we're focusing on that we're working on access to health care, we're working on social economic barriers, and we're working on environmental equity was what came out of what the community cared about, the health department working on. So more of those social root causes of health versus those scary big threats that people see.
People see and deal with all the time. All right, Dr. Sarah Moyer, it's always great having you on the show.